Today we're going to run through the basics of carrying out a health check on a donkey, and all of this could be applied to a horse as well. Why do we need to do this? Well, we need to pick up on any donkeys that are sick and need veterinary attention. It's really important that we keep the database accurate and up to date. We need to know as much as possible about any donkeys that you have selected to go out to a home. The more you handle the donkeys, the sooner you will learn what is normal for donkeys and what may not be. And it's a great excuse for having some one-to-one time with the donkeys. Why not practice on a donkey that you know is very quiet and easy to handle? So how do we do this? It's ideal if two of you can work as a team. One of you may spot something the other misses, and you will have the chance to discuss anything you find that seems abnormal or unusual. Work in an area where the light is good and you have the space to lead the donkey around to see if it's walking normally. Have the donkey wearing a head collar and a lead rope. And please always think about your own safety. A frightened donkey could react by kicking or biting. Just keep everything nice and quiet and relaxed, and keep praising the donkey and reward quiet, good behaviour with a scratch on the shoulder area. If you watch donkeys grooming each other, you will see that this is the area they tend to groom for their companion. You really don't need much in the way of equipment. The most important things are your own eyes, nose and hands. A hoof pick is essential, as you cannot assess the underside of the hoof if it's packed with sand or mud. A scanner should be used to check if a microchip is present. If a donkey happens to produce some poo, then do check this for any long pieces of fibrous food, as this can tell us a lot about the state of the teeth. Any pieces of food longer than about 3 millimeters means the donkey is not chewing properly and needs attention from the vet. And I promise that's the last picture of poo for today. Of course, you need to record your findings, written and in pictures. Just think how useful a good picture of something abnormal could be if you send it to the vet. It may save the cost of a visit or allow the vet to decide how urgent the visit is. And there is nothing better than a series of pictures taken over time to see if a lesion is changing in size or shape. This is a form you could use, although some of the data can only be checked by a vet, such as a detailed dental examination. If I could sum up the health check in just 8 words, it would be: say what you see and say what you feel. When you select a donkey for a health check, do bring their bonded companion too, or both will be stressed and will not behave normally. It's so important from a rehoming point of view to know which donkeys are bonded. What can you say about the donkey's behaviour? Is it good to have a head collar put on? And can you easily lead it around on the lead rope? This is so important if a donkey may go out to a home with inexperienced people. Does the donkey walk soundly? How would you describe its behaviour? Any kicking or biting, barging or attempting to run away? Is it quiet? Does it like being handled or just tolerate it? Please consider your safety, especially in the case of a new donkey that may be very scared and unused to being gently handled. In terms of its body condition, is the donkey just about right? Is it too fat or is it too thin? Bear in mind that donkeys are quite angular and should not have the round hind quarters that a horse has. A slightly pendulous abdomen is normal. Does it have a crest of fat along the neck or back? You may develop a system of your own, but today let's start with the head, as there is a lot of information we need to gather at this end of the donkey. Have a look from the front at the whole head of the donkey. Then draw an imaginary line down the middle of the face and look for what should be almost perfect symmetry. You can see that the horse on the right of the screen has a swelling on the right side of his face. Those magnificent ears, one of the best features of donkeys, but are they both there? Are they damaged? Importantly, can you stroke the ears? Most donkeys really enjoy having the inside surface of the ear gently rubbed, but some are very ear shy, and this needs to be noted. We are looking for a matching pair of eyes with no discharge and wide open. Check the angle of the eyelashes. They should be the same left and right. But look at the donkey in the second picture on your screen. Can you see that the right eye is half closed and the eyelashes are angled further downward, a sure sign of pain? If there is any discharge, is it pussy or watery? Donkeys are very good at hiding any sight loss, but you can check for vision. Have a look at this experienced owner checking for sight in her donkey's right eye by moving her hand fairly quickly closer towards the eye. The normal response in a sighted donkey is for it to blink. Looking at the nostrils, again we're looking for a matching pair, which are dry. Check for any discharge. Is it watery or is it thick and pussy? Importantly, is the discharge one-sided or affecting both sides? One-sided discharge normally indicates a problem with the teeth, whereas bilateral discharge could point to a systemic disease such as strangles. And if it's safe to do so, smell the nostrils and there should be no bad odour. Feel both sides of the lower jaw, which should feel identical, and feel in the space in between the jaw bones. In a young donkey, the lower jaw bones will be thick, and you may feel bumps along the lower surface, where the base of the cheek teeth lie. In an old donkey, the bones may be slimmer, as they have less length of cheek teeth left. Any big lumps and bumps in the space between the lower jaw bones could be of concern. Now, you will be lucky if the donkey opens his mouth for you, but gently holding the lips open, you should be able to see the front teeth, which we call incisors. Only do this if the donkey is not reacting badly. Can you count the teeth in the upper and lower jaws? There should be 6 in each row. The art of telling the age of a donkey by its teeth is not very precise, but basically, the longer the front teeth and the further angled forward they are, the older the donkey. You may want to check out some mouths of donkeys whose age you know, such as the youngsters that were born at the sanctuary. For those that are less than 2, you will be looking at their baby teeth, as the adult teeth do not start to come through until the donkey is about 2.5 years old. Looking from the side, you can see if the upper and lower teeth meet each other as they should, or whether there is an abnormality, such as the donkey on the right of your screen. And you can also see the perfectly normal gap between the incisors and the cheek teeth, which may or may not contain a small additional tooth called a canine tooth. What you cannot check visually are the cheek teeth. As you can see from this picture, there are 6 teeth in each of the upper and lower jaws, and they take up a large part of the face, right up to below the eye. Only a vet or qualified equine dental technician with special equipment can see and assess these teeth. What you can assess, however, is the condition of the cheek muscles. That's the blue area on the picture. The cheek muscles power the grinding action of the cheek teeth and should be so thick that you can't feel the jawbone beneath. If you are feeling directly onto bone in this area, that is not normal. Whilst you cannot visualize the cheek teeth, what you can do is feel externally along the row of cheek teeth and you may identify gaps where teeth are missing or sharp points on the sides of the upper teeth. Have a look at the video of an experienced donkey owner checking the first few cheek teeth in her donkey. Now let's move on to the legs. Are they a matching pair at the front and the back? Are the joints the same size? You can assess this by eye, but even better, run your hands down each leg if you feel safe to do so. And the hooves. Again, look for symmetry. Some donkeys may have different coloured hooves on each leg, and that's quite normal. The hoof wall should be smooth, as in the picture on your left. What do you think of the horse's front hooves in the second picture? Can you see that they are not a matching pair? And notice the ridged appearance of the hooves in the third picture. These ridges in the hoof wall can point to a problem internally and should be checked out by the vet. The only way to diagnose such problems is to take an X-ray of the hooves so we can see what's going on inside. It's quite obvious from the picture on your right that hooves can become very overgrown. Have a look at this experienced donkey owner lifting the feet of her donkey.
Good girl.
Note she stands very close to the donkey. She's quietly confident and praises the donkey for standing still and not resisting. And see how she runs her hand down the inside of the hind legs in order to lift the hind feet. She's also using a hoof pick to clean out the underside of the hoof so she can check for any abnormalities.
Good girl. There's my clever girl. Who's a good girl? Good girl. And up. Good girl, thank you. Good girl.
The normal underside should be slightly concave, as you can see in the picture on the left. This is a perfect donkey foot. Check out some of the youngsters and you may see feet as good as this. The picture on the right is that of a horse, and you can see in outline the horse is somewhat rounder than the U-shaped donkey foot. What's left? Well, now is the time for the whole body check. Make this pleasurable for the donkey. Stroke the donkey all over to identify any abnormalities. And now would be a good time to check for a microchip. Problems like loss of hair and scabs or wounds are easy to see on the top and sides of the donkey, but we need to check out what is going on underneath, and this requires a confident, flat-handed technique. If your hand feels like a fly landing on the donkey, he will react accordingly and may try and kick your hand away.
He's a good girl.
So using a confident, firm, flat-handed approach is much safer. And even if the donkey tried to kick, it's unlikely to actually reach your hand, as your hand is laid flat against the donkey's body. Have a look at this experienced owner checking the udder of her donkey mare. Things you may identify underneath are tumours, such as this one on the genitals of a male donkey. And that's it, a basic health check. Thanks very much for listening, and please always be aware of your own safety and enjoy interacting with the donkeys while gaining some really useful information about them. If there's anything you'd like more information on or any queries you have at all, please feel free to contact me. Thank you.